Hello, welcome to my frequently asked questions. Today I'm asking a commonly asked question about rhinoplasty. Who is the best rhinoplasty surgeon? How can I find the best rhinoplasty surgeon for me? So my approach to looking at this is, well, really we want to look at several factors. And I'm going to talk to you about each of these in turn. And the importance of this is, well, really rhinoplasty is regarded as the most sophisticated or challenging plastic surgery procedure in the body. And really the reason for that is the detail. There's a lot of detail in the nose and it needs the right care and attention to give the right result for you. So in terms of who is the best surgeon for me, there are 7 things that we're going to look at. Firstly, credentials. A lot is made of credentials, so let's talk about what are the right credentials. Secondly, experience. Thirdly, the artistry of the procedure. Fourthly, the detail involved in the nose and rhinoplasty. Fifthly, reviews. Sixthly, the results, and we'll look at a few examples of case studies. And then finally, some tips which I believe are important. So, first of all, my name is Dr. Julian de Silva. I'm an oculofacial plastic surgeon based in London, and I've completed fellowships in London, in New York, in Los Angeles, and my everyday bread and butter work is really rhinoplasty, facelift surgery, and blepharoplasty, and those are the procedures that I do every day for my patients. So, although this information is meant to be helpful to you, really it doesn't construe the same as a consultation, and really you do need to see a doctor and talk through your individual circumstances for medical advice. So in terms of credentials, well, a lot is made of being a specialist, board certification. Well, what does this really mean? Well, there's different surgical specialties that can provide these kind of procedures. General plastic surgery, these surgeons often do rhinoplasty as well as other cosmetic surgery, not just on the face, but the rest of the body. ENT surgeons who do rhinoplasty, but they also do functional surgery. We also have maxillofacial surgeons who are also trained in dentistry as well as medicine, and they also perform this procedure. And then other specialties as well. And in terms of these, well, rather than board certification, you really need to find someone who's doing a lot of rhinoplasty, because it's really someone who's seeing a lot of patients and treating a lot of patients will have more insight into the intricacies of the procedure. So, well, some plastic surgeons really favor breast surgery and body surgery, and they may only rarely perform rhinoplasty, and those surgeons might not be ideal. But then there are other plastic surgeons who really concentrate on the face who may do a lot of rhinoplasty. Similarly with ENT and facial plastics, well, some surgeons do a lot of cosmetic rhinoplasty, but then other ENT surgeons really focus on more functional conditions and functional illness, and they may not favor so much the aesthetic elements of rhinoplasty. So really, in terms of board certification and specialism, well, you really need to find a surgeon who really is doing rhinoplasty every day for patients. In terms of fellowship training, publications, awards, well, these can also be helpful because they give more credibility to the surgeon. And you of course look at these elements all in turn. How about experience? Well, really to specialize in rhinoplasty, you really have to have years of experience. And I've been practicing facial cosmetic and facial plastic surgery for nearly 10 years now, and I would say in my experience, well, to become really skilled at something, you really need 3 to 5 years to really have the experience and skills to really understand that subject. And there was a wonderful book by Malcolm Gladwell who wrote about outliers, and really he looked at what makes someone truly specialized in a field. And by his estimation, you need to spend 10,000 hours in an area to be truly excellent in that area. And so definitely rhinoplasty is a procedure that does take years to develop those skills and knowledge to give every patient the best possible result. Artistry, well, in my opinion, 50% of rhinoplasty is the technical detail. looking at measurements, measuring the cartilage on the right and left side, comparing the two, putting in specialized stitches, using graft material. There's a lot of technical detail in this kind of procedure. But the other 50% is really artistry, because there's no perfect measurement. If the nose tip is X millimeters, that will make it perfect. The bridge in relation to the tip, if the ratio is X to Y. So there's these measurements, although we can take them, there really is an interpretation by the surgeon as an artist to define what is going to be the very best for this patient. An example I sometimes talk to patients about, well, when you make a nose smaller, it tends to make the tip wider. And no one wants a small nose with a wide tip. So there's always a balance to be made, making the nose smaller, but also shaping the tip to give the very best result. Another way of looking at this, well, you can't do the same thing for every patient. There's no cookie cutter approach when it comes to rhinoplasty. And really, this is a procedure that takes 2.5 hours. And if it's more complex and revision surgery, well, it can take certainly longer than that. Detail orientation. So when you look at the nose, well, there's so much detail in the nose. The top third of your nose is bone. The middle third is one type of cartilage. The tip is a different type of cartilage. Each one of these has a right and a left side. There's junctions between the bone and the cartilage. The skin differs from each person to the next. Some patients can be very thin, some patients can be very thick. So really, your surgeon looking at your nose has to really take into account this level of detail, because it's these details that really make the difference in rhinoplasty between a good result and an excellent result. Reviews. Well, of course, reviews are important, and you really want to be seeing a surgeon who has good reviews and positive feedback and happy patients, and that certainly is important. The reality is there's no surgeon that has pleased 100% of all his patients, and there are always going to be a tiny minority of people who are unhappy. But really, when you look for the right surgeon, you really want to find a surgeon whose great majority of reviews are positive and patients are generally very happy. So the other thing that I think is useful is really to look for patients who look like yourself. So there's different characteristics of the nose that can be important. And so say looking at this image, well, this lady had like a really large hump on the bridge of her nose, and her nose looked too large for her face. It was over projected. And so really with this patient, I was looking to make her nose smaller, less projected, reduce the shape of the bump to give her a more feminine appearance, like a very gentle curve, not too much, not a ski slope, just a very gentle feminine curve, and just make her nose more in proportion to her face, as well as respecting her ethnicity and not overdoing things, keeping things in balance, making things look natural. Now, other characteristics of the nose, well, other patients, well, you might notice, well, it's really the tip that bothers me. So you really want to look for a surgeon who's really done lots of tip surgery on rhinoplasty, and they've got good results in terms of refining the tip, because each element of rhinoplasty is just that little bit different. So in this lady, well, she's got quite a square tip, and it's just wide, and sometimes this is termed bulbous in medical jargon. And afterwards, well, it's just more refined. It's more pyramid shaped, it looks finer at the tip, the nostrils are made narrower, and overall her nose just looks more feminine. Refinement rhinoplasty. So quite a lot of patients who come to see me, well, they're not looking for a big change, they're looking for just a fine refinement. It's something, often rhinoplasty is a procedure where a person has been really bothered by the nose for many years, and it might be just subtle things to most people, but to themselves it's something very important. So this lady who came to see me, well, she just wanted it that little bit smaller, and she just wanted a little bit more feminine appearance, and so I made her nose look smaller. I just refined the shape of her bridge, and although most people will not necessarily notice this when they see her, she was super happy, because that was exactly what she was looking for. The other factor with refinement, well, it often requires a bit more patience because at 1 week when there's swelling, you don't see that much change. You have to be a bit more patient. If you have a really large bump on the bridge of your nose, well, even in a week, it can be a massive difference. And often it can be a little challenging because very fine changes are often require very fine surgery and are more delicate to do. Male rhinoplasty, well, male rhinoplasty is different to like female rhinoplasty, and it should be more conservative because to preserve a more masculine appearance of the nose, well, you don't want too much curvature. You want to have like a straight bridge, a more dominant bridge. It's important to take in the characteristics of the person. If you're 6'2", 6'3", well, you want to have a nose that matches your kind of your physical being. And so in this patient, well, he had a bump. The light caught the shape of the bump, and it was just not appealing to him. And afterwards, well, he looks just a more refined version of himself. And then, of course, we have a revision surgery. In revision surgery, well, what makes this more challenging is there's some scarring in the anatomy of the nose, there's change in the natural anatomy, and these factors, well, they can be more challenging to overcome. And we're looking at one example here where the patient had a bit of, sometimes it's called polybeak, like the shape of the nose just is not so attractive, and there's too much nostril showing, and because the alar has been changed, and the bottom part of the nose called columella is just hanging down. Now, often revision rhinoplasty needs specialist grafts, and these grafts can be taken ideally within the nose, but sometimes they need to be taken from the ear, and then sometimes you need graft material from elsewhere, like from either your rib cage, or I have specialist graft material imported from the US. But the other parts of this are, well, revision surgery can be very challenging, and you often don't know exactly what you're going to find until you do surgery. And so there's often more swelling, and you need to be just more patient, partly with the recovery and partly with expectations for improvement, because some things can definitely be improved, but not everything can be made perfect. And then, of course, ethnic rhinoplasty. In ethnic rhinoplasty, whether it's Middle Eastern, Afro-Caribbean, Asian rhinoplasty, well, there are different aspects to the cartilage, the bone, the skin thickness, and these are very important because those considerations really determine the result. Often patients with thicker skin, well, they may need graft material to give more definition and give more shape to the nose. So that's exactly what I did for this lady. I used graft material just to make her bridge just more defined. Her nose just starts a little bit higher, which just makes it just look a little more proportioned and more elegant in the face. And I also refined the tip, but because she's got ethnic skin, I also use graft material to give more definition in the tip. So, well, finally, what are my tips with rhinoplasty? Well, every surgeon tends to have like a different style, and a lot has been made, particularly online, about, well, I only do closed rhinoplasty, or open rhinoplasty is the best, and surgeons differ in their thoughts on this. And in my opinion, there isn't one size fits all, and some patients will benefit from a closed rhinoplasty. And if you have a small bump on the bridge of the nose and minimal or no asymmetry, then a closed rhinoplasty can work very well to give you like a very good result. However, another patient who's got a lot of asymmetry and breathing issues, and often you need to look at this from a holistic perspective, and an open rhinoplasty does enable you to see that bit more. And by that I mean like a little scar under the nose enables you to look at the anatomy, measure it, and improve those asymmetries. So it really depends on what you need is going to determine what's going to be the best technique for you. Cost versus quality. Well, of course in life you can always get something really cheap, but ultimately with something like rhinoplasty, you really want to look at the holistic perspective, which is doing this once, making it the very best you can possibly be, and being able to enjoy the results of that rhinoplasty for the rest of your years. Rhinoplasty can be done in an hour, or it can be done in 3 hours, and depending on the detail and how things are looked at will determine how long the surgeon takes during the procedure. My feeling is it's always better to go for quality and make things as good as you possibly can, but of course there are some patients who choose to go overseas, and some of those patients come back and they do need to have further surgery, and often that revision surgery is more challenging. New technology. Well, there's always new ideas and technology on the forefront, and over the last few years, piezo has become very popular, and this is a use of ultrasound primarily to narrow the bones in the nose. So a lot has been made of this technology, and I personally think it's good for a small proportion of patients, particularly if you have a lot of asymmetry and asymmetry of the bone. But it's certainly not ideal for every patient. And although a lot has been made of marketing this as a wonderful way of doing surgery, it does result in more swelling, and it does result in more surgery to the anatomy of the nose, which results in that longer recovery. So I think new technology is very helpful in many ways. I'm a great advocate of regenerative medicine and using regenerative medicine to heal the body faster, but it has to also be taken in the context. And some technology, well, it has advantages only for some proportion of patients. The other factor which I think is very important is patient experience, because we talk a lot about recovery after surgery, swelling, and the final result after the surgery, which might be a year or longer after rhinoplasty. But it's also an emotional journey, and for an emotional journey, you really want a surgeon who will be there for you and will be able to provide you with the support and the experience and care that you deserve. And so that really requires reading around the surgeon and getting experience about their patients and their patient journey. Because for some patients, it can be a bit of a roller coaster of emotion, and having that ability to go to your doctor and get advice during the recovery period is really helpful. Operating facility, well, I personally have my own private operating theatre, which enables me to just look after my patients and have a lot of control over when patients are operated on, and things like COVID have not affected my surgical practice because we have that opportunity. Some surgeons take their patients to a private facility, an operating theatre, where those options may be a bit more challenging. But ideally you want an operating theatre that specialises more in private care. Second opinion. Well, sometimes if you don't feel like you've got the right answers after a consultation with a surgeon, my recommendation for patients I see is, well, it's worth having another opinion, because sometimes patients will come and see me and they've got a very specific idea of exactly what they're looking to achieve. And if I don't feel that that's going to give them a good improvement, I personally am very sincere with my patients and I advise them, well, it's worth you having another opinion. It's worth you seeking another opinion too, because this is a bit of an artistic treatment and different surgeons have different styles. And my personal preferences, I like a really natural result, someone who gets a really good improvement and is the best version of themselves, but not too much change. Life events. I mean, we ask all patients before doing surgery if they've had any serious or significant life events in the last 6 months. And this is really important because if you've gone through relationship issues or financial issues or career issues, it might not be the best time to do facial surgery soon after that event. And generally I would recommend just waiting so you're in a kind of stable, kind of emotional state, because when you're under a lot of life stress, everything is a bit more of a journey, and certainly facial surgery can be a roller coaster if you're in quite an emotional state. And then finally, well, you need to do some research. You need to look into the surgeons you're going to see, you need to research them and look at some of the things that we've been talking about. So in terms of things, well, we've been looking at the credentials, we've been looking at experience, we talked about the artistry of the surgery, we talked about how important the detail is, looking at surgeons' reviews, what are their results from surgery, looking at their before and after photos, and I've also given you a few of my personal tips. I hope this has been useful for you, and if you have any questions or thoughts or anything further you'd like to ask me, please do not hesitate to contact us. You can always call us or contact me through my website. Thank you for watching.